this time, I'd like to yield to the second vice chair for the Congressional Black Caucus. She's a strong leader for her constituents from New York, the gentlelady from New York, Ms. Clarke.
Thank you very much, Congressman Horsford, and I thank you for your leadership along with Congressman Jeffries in leading the special order hour for the Congressional Black Caucus. Mr. Speaker, I rise today to join my colleagues in the Congressional Black Caucus in raising awareness about health disparities that continue to affect racial and ethnic minorities in the United States of America. Despite medical advances that save many lives in our country, there has been very limited progress in ending the racial and ethnic disparities in health. In a 1985 report, the United States Department of Health and Human Services called health disparities in this country, quote, an affront both to our ideals and to our ongoing genius of American medicine. And now, decades later, health disparities still exist between black and white, rich and poor. A primary reason for these disparities is, quite frankly, the lack of health insurance that has been a problem for all these many years. For instance, African Americans make up 13% of the entire population, but account for more than half of all people who are uninsured. Blacks also have disproportionately lower access to primary care and face more obstacles in seeking treatment. Across our nation, health disparities continue to persist and widen in communities historically marginalized as a result of poverty and other social, economic, and environmental barriers. These communities are experiencing a high burden of life-threatening diseases and poor health outcomes. Population-based approaches, such as recent efforts to reduce childhood obesity rates while showing evidence of success, have been primarily focused on white children in affluent communities. For example, in a report released in 2012 by the CDC, New York showed an overall decline as much as 10% in obesity rates for kindergartners. However, for poor black children, the decline was only 1.9%, and for Hispanic children, it was 3.4%. In my district in Brooklyn, New York, I represent a very large number of immigrants. Close to 40% of the residents are first and second generation Americans. Culturally significant and linguistically tailored education is required to address health disparities. This education is one of the building blocks upon which improvements in early detection and screening in these communities have been built. Disparities are a serious matter. According to the National Urban League State of Urban Health report in 2009, health disparities cost the United States economy $82.2 billion. I firmly believe in prevention and addressing health disparities, and that it will go a long way in bringing these costs down. It is important that we fully engage in a full implementation of the Affordable Care Act. This will lead us to closing these disparities, this health disparity gap. I look forward to working with my colleagues in the Congressional Black Caucus and, quite frankly, all members of goodwill to find solid solutions to addressing health disparities in communities of color across this nation. Having said that, Mr. Speaker, I thank you for the time to my colleagues.